This morning, Jason Kenney is meeting with his cabinet to discuss new actions to combat COVID-19. Now, based on his comments yesterday, we're led to believe these decisions will likely be targeted to the Banff area as well as the regional municipality of Wood Buffalo. Now, while we welcome any additional help for these communities, a regional approach will not be effective unless the Premier is willing to introduce travel bans. Dr. Hinshaw has said this many times. And Banff and the regional municipality of Wood Buffalo are not the only parts of this province that are seeing dramatic growth in cases, growth that is now threatening to overwhelm our healthcare system, our hospitals, our frontline health providers. Close to half of all active cases are in Calgary, and the R value in Edmonton is now 1.1. There are outbreaks in more than 60 long-term care and supportive living centers and more than 275 schools. These outbreaks are being reported across the province, from the biggest cities to the smallest towns. And yesterday, we recorded our third highest daily case count on record. We may well break that record today. Based on his latest comments, the Premier intends to push our hospitals to the brink and force these life and death decisions on our frontline healthcare workers. It's obvious that this is not a strategy based on public health or the calls of the medical community. No, we have a Premier who is making these decisions based solely on his own party politics, on quelling his own MLA rebellion, and his fears over the threats to his own leadership. And then to justify his inaction, he insults the intelligence of all Albertans by making excuses and telling lies. This has been a pattern for months. Jason Kenney said COVID-19 is just an influenza. He said it doesn't threaten life apart from the elderly. He's argued that other causes of death are more serious. He said Albertans who contract the virus aren't actually sick. He said children do not contract COVID-19 and do not spread it in school. He allows his MLAs to undermine the Chief Medical Officer of Health. He says anyone who tested positive now has natural immunity. And he said Indigenous vaccine hesitancy is driving the spread in the North. And yesterday he had the nerve to argue that there's no direct link between public health restrictions and preventing community spread. The third wave is devastating. Albertans are running out of patience. It's time for this Premier to lead. And the question is, does he have the guts to do the right thing?